Diabetes is a disease that affects more than 29.1 million people in the United States.
Glucose is an important energy source, and insulin is a hormone that allows glucose to be absorbed.
In type 1 diabetes, the problem is with the pancreas, which does not produce enough insulin for glucose to be absorbed by the body. In type 2 diabetes, insulin is produced, but the insulin receptors in the cells do not recognize the insulin, and therefore glucose is not absorbed in the cells. Symptoms of diabetes include excessive hunger, excessive thirst, frequent urination, and fatigue. In order to diagnose diabetes, a person is required to take a glucose tolerance test. The person is given a sugary mixture to drink, and then blood is taken at 30-minute increments for 2 hours. The glucose level of each blood sample is studied, and if the person's blood glucose level does not return back to normal levels, then that person has diabetes. To determine if a person has type 1 or type 2 diabetes, an insulin test is performed. The person is given a sugary drink and blood is taken at 30-minute increments for 2 hours. If insulin levels spike, then that person has type 2 because it shows that that person is producing insulin. If the insulin level remains stable, then the person has type 1 diabetes because not a lot of insulin is being produced in the body.
Diet is especially important to someone with diabetes. Diabetics should avoid foods high in cholesterol, trans fats, and carbohydrates. Vegetables, fruits, and meats are good foods to eat, as well as foods high in vitamin C.
Type 1 diabetes is not preventable because the person is born with it. However, type 2 diabetes is caused by poor lifestyle choices. In order to prevent type 2 diabetes, a healthy diet and good exercise plan is necessary.
A person with type 1 diabetes uses insulin injections to regulate their blood glucose levels. A person with type 2 diabetes must maintain a healthy lifestyle by eating a good diet and exercising daily. Living with diabetes is manageable, but special precautions must be taken to remain a healthy lifestyle. Monitoring your blood glucose level is crucial. Insulin pumps detect blood glucose levels automatically and administers insulin when needed.
Insulin injections, you administer the appropriate amount of insulin after you check your blood glucose levels. You should do this before and after you eat. Complications with diabetes includes diseases like periodontitis, which is the inflammation of the gums. Diabetic can meet with a certified diabetic educator who can guide them about exercise, diet, and overall lifestyle. Diabetes doesn't stop a person from living a full life. With the right treatment and care, diabetics can accomplish anything.